Hello, everybody. Welcome to today's session. My name is Heidi Miner, and I am from the Data Management Training and Technical Assistance Unit. Today's topic is on the OASAS Client Data System Transfer and Medication for Addiction Treatment Update transactions. Before we get started, I would like to have my co-hosts introduce themselves, starting with Teresa.
Hi, I'm Teresa Young from Data Management Training and Technical Assistance. Emily?
Hi, I'm Emily McCluskey, and I'm also from Data Management Training and Technical Assistance.
Good morning, everyone. I'm Leslie Perrier. I'm the Director of the Bureau of Opioid Treatment with OASAS.
Good morning. I'm Karen Marcus. I'm the Supervisor of the Bureau of Opioid Treatment.
Good morning. My name is Paula Snyder, and I work for the Bureau of Treatment Services.
Thank you, everybody. So on the agenda for today, we have overview of changes to the PAS 47 transaction, using the PAS 47 to complete a transfer transaction, using the PAS 47M to complete a medication update transaction, and a few housekeeping notes. Questions can be placed in the chat and will be addressed at the end of each section. Ensure that questions aren't messaged privately to the presenter or host. Messages to everyone allows other co-hosts to support the chat box. And this training is being recorded and will be posted. Up first, we have Transfer and Medication for Addiction Treatment, also known as MAT, Update Transaction Overview. Historically, the PAS 47 has been referred to as the transfer form or transaction. It allows a provider to move an individual from one certified treatment program to another under that same provider within the OASAS Client Data System, or CDS, without discharging and readmitting that individual in the CDS. This allows for continuity of the treatment episode while lowering the administrative data entry burden for providers. In September of 2025, OASAS added a new reporting requirement effective October 1st, which requires programs to report the status in the change of the use of medication for addiction treatment, also known as MAT, as part of the individual's plan of treatment at the program. This information is submitted via the PAS 47M in the CDS. Programs must report the following MAT changes: methadone dispensed at the window, buprenorphine dispensed at the window, naltrexone for MOUD administered at program site, naltrexone for AUD administered at program site, buprenorphine prescribed by program practitioner, other AUD medication prescribed by program practitioner, no MOUD or AUD medication within the program. Please note, programs do not need to submit a PAS 47M transaction for changes in dose, frequency, and/or take-home supply. Updates to the status of medication as part of the plan of treatment are critical to OASAS for program evaluation, as well as identifying differential treatment outcomes based on the use of MAT. Today we're going to go over the use of the PAS 47 to complete a transfer transaction. Before the demonstration for this type of transfer, we will be breaking for any questions. The transfer transaction moves the individual's treatment episode from one OASAS certified treatment program to another. These programs need to be operated by the same provider. They must be of a similar program and service type. A table of allowable program combinations can be found on the Home tab of the OASAS Applications page under Forms and Instructions, which is shown below. Examples of allowable combinations include an outpatient clinic to a CCBHC or a community residence to a Part 820 residential treatment program. Crisis programs, Part 816s, can't enter a transfer transaction in the CDS. To complete a transfer transaction, the information needed includes identifying the client or clients being transferred, the program number of the receiving program, the date of the transfer, element of care and reintegration setting, which is applicable only to Part 820 residential programs, MAT that will be provided by the receiving program, and locator, assessment ID, and date are optional items. To complete a transfer, any delinquent treatment update, PAS 26 transactions, up to and including the date of transfer, need to be entered into the CDS prior to entering a transfer. There are 3 ways to complete a transfer transaction. 1, using the batch submission process. 2, via the transfer link shown in this picture. This path allows the user to search by program, transaction dates, and/or client identifying information. This also allows the user to enter transfer transactions for up to 25 clients at a time. And the third option is via the Client Management MAT Update link, which is shown below. This path allows the user to search by program, transaction dates, and/or client identifying information. This path limits the user to entering a transfer transaction for 1 client, not multiple clients. Any transfer transaction that involves a child in residence check-in must be completed via Client Management MAT Update link. I am going to go ahead and pass it over to Teresa now for questions and the demonstration.
Any questions about the transfer? I will start. One question just came in. Who is responsible for filling out the PAS 47 form? So any certified treatment agency other than a crisis program can submit the 47 and the transfer form, and it, as Heidi mentioned, it moves a client from one program to another. Who submits that directly to our CDS is determined by your specific agency. So however your program dictates that responsibility for the actual data entry will be who enters it. Will the change from into auto-populate? So we'll show in the demonstration that the information of the from program does auto-populate. The to program is something that the user has to enter. How does this work with integrated programs that only have one PRU? So if you're an integrated program, you would not be transferring people because it is one program. This is between 2 different program numbers. And Paula, thank you for that webinar information. Will there be batch specifications available? Yes, I'm going to show them now, actually in just a second. They are already available. Next question is, so if we transfer a client from one OTP to another OTP, we would use this form. Yes, if you're transferring someone from one OTP to another OTP within the same provider, and it has to be within the same provider, you would be using this form. If they're going to an OTP that is outside of your provider, you would need to submit the 45, which is the discharge form, and the other program would submit the 44, which is the admission. So we have another one. Sorry, just to be clear, we only need to fill out this form if we are transferring to a different program number. The transfer form is only for if you're moving to a different program number. Yes, that's correct. We have an 820 and 819, but don't provide MAT. Do we have to do this? So currently we're talking about the transfer form, and yes, you either have to do a transfer form or an admission and a discharge if people are changing programs. Is this required for patient transfer to continuing care within the same program? So if a client is going to continuing care, they would be discharged from active treatment. So you would be submitting the PAS 45, not the 47, and then you would be completing the continuing care form whenever you see that individual for continuing care services. Does this relate to Part 822 that are not OTP? Yes, the transfer form, the PAS 47 transfer applies to all programs that are not crisis programs. Between OTP that are part of health and hospitals needs this form to be completed. Yes, if they're changing OASAS program numbers to a different OTP, you need to do the PAS 47 transfer, assuming the new OTP is within the same provider number. If a client is in an 820E3, if you are transferring within your own programs, yes, the PAS 47 transfer is only used when a client moves from one program to another under the same provider. If they're going to a program outside of that provider, you would be doing the 45 at your program where they're leaving, and the new program would be submitting the 47. I'm sorry, for the 44. This is only used if you're transferring within your own programs. Yes. Let's see. We have a Part 816 and an 818. Frequently discharged detox patients to our rehab. Would a transfer form be required? Again, the detox would be considered a crisis program, so no, you cannot use the 47 transfer. The detox program would be completing the PAS 46. The inpatient program would be completing the PAS 44, and then when the individual leaves, they would submit the PAS 45. We are at iOS with CCBHC and also have a crisis stabilization. Crisis stabilization will not be providing medication. If person goes to crisis stabilization and then to us, still do a transfer summary. This is a client. So the crisis stabilization doesn't report in the CDS. So they report, I believe, information directly to OMH. So you would need to, the crisis stabilization would still have to do whatever they are required to report to OMH. When the client comes into the iOS outpatient program, you would be submitting the PAS 44. There is a MAT question on that 44. And then if the client were to transfer to another outpatient program within your provider, you would be doing the transfer submission at that time. Next question. So if we are changing from one program and then admitting to another, rehab to stabilization, do we fill out the 47, the PAS 47? We will be filling out the PAS 44 and 45 for each. So if you are already submitting the 44 and the 45, you would not do the PAS 47 transfer form because you're covering that change in program number through the 44 and the 45. The PAS 47 transfer is an alternative to those 44 and 45s for a provider. So if you have someone who is, let's say your provider has a community residence and the individual is going to move from that community residence to a Part 820 where there's supported living available, sort of that scattered site 820, and it's within your provider, you could do the 47 as an alternative to discharging with the 45 from the community residence and readmitting with the 44 into that 820 scattered. So it's done electronically and sent electronically, or it has to be printed in fax. The PAS 47 information is submitted as all other CDS transactions. It's either done on the user interface, as I'll be demonstrating, or you can submit via batch, whatever your provider does. We do not accept printed and faxed information. If a client is completing an 818 program and moving to an 822 with the same provider, does a PAS 47 and 45 need to be completed, or just the 47? So when you do a transfer form, and I will show that, actually I'll do that now, on the application site, we have an allowable transfer table, which I believe Heidi mentioned, and it's down here under CDS information. This will tell you, let me see if I'll open it up, gives the combinations that you can use the 47 for. So it has to be a similar program type. So an OTP can transfer to an OTP. It could transfer to a comprehensive outpatient program. An outpatient clinic could also transfer to a comprehensive outpatient program or a CCBHC. Inpatients can transfer within inpatients. Residential programs can transfer, like I mentioned, a community residence to a Part 820. Part 820s can transfer back and forth. But you could not do the 47, say, from an inpatient rehabilitation program to an outpatient clinic because they are different sorts of programs. There are different levels of care. For different levels of care, you do need to complete the 45 and then again complete the 44 at the receiving program. How is this different from the PAS 48? Which what do we complete to transfer a client from outpatient services to continuing care? When the individual is no longer in active SUD treatment, you would complete the PAS 45. That is discharging them from active treatment. And then when the individual comes into your site or you provide continuing care services, you would submit the PAS 126 for those visits whenever you have those services delivered for the individual. Hospital umbrella, but are their own programs? Would the PAS 47M be required between all of these programs or just within the grouped programs? So the PAS 47 is within a program. The PAS 47M is within a program. The PAS 47 transfer is between two programs under the same provider number. We have 12 residential sites, each with their own PRU. Would a PAS 47 need to be completed when transferring between our residential programs? Yes. The PAS 47 is the simplest way to move that client to a different residential program. You have the option of doing the discharge of the 45 and resubmitting the 44 at the new program, but it is, I think, much simpler to do the PAS 47. If a client up to the top here, in addition to the forms and instructions, we have user guides, which will give you step-by-step. I'll just open the transfer. Step-by-step instructions on how to navigate through our system with little boxes indicating where to click. And over here we have online tutorials. And here are the links to our videos. So in approximately 2 weeks, we will post this video. The link will be here, and you can access it at that point. Let's see, we are an OP with an additional location that shares the same prescriber. Would we do the 47 if the client moves to an additional location from our main location? So if the additional location shares on an OASAS operating certificate, there's often a main site, and then if you have an additional location, they are on an addendum. If that additional location is on the addendum for that main site, you do not need to do the 47 transfer to move them to that different physical site. So if they're just staying within that program number, that additional location should be reporting under your main site program number. The transfer, and then if we have any questions on the transfer, I'll take them after that point. And then we will go on to the math section. So if you, Lisa, her question is, we are in a comprehensive outpatient program with only one site. I'm unclear of when we would complete the 47. So if you only have one OASAS certified site, you would not be completing the PAS 47 transfer. However, being a comprehensive outpatient program, I would expect that you will be submitting the PAS 47M at some point in the future. So whenever MAT changes to happen after 10-1, I assume you'll be submitting it for that purpose. So going on to the applications. I'm sorry, I did say that we would show the batch app information. The batch information is at the bottom of the Home tab under the heading CDS Batch Submission. It has been updated for the PAS 47 changes, so all of that information is available, and testing is also available for individuals who wish to test records with the 47 updates. Okay, so we're going to go to Client Data System. It should pre-populate with your provider information, and we'll see the link that says Transfer. And here is the way that you search for your transfer. You can search by program, you can search by transaction dates, or you can search by client ID, and you can either put in the client ID or part of the tracking ID, or all of the tracking ID, which is sex at birth, date of birth, the last 4 SSN, and the first 2 characters of the last name. So I'm just going to, I'll pick female, click find, and because I didn't identify a program, this will pull up every individual in the provider who has female sex at birth, and I could do multiple transfers from this one screen. If I go back, I can narrow this to a program, and I will choose program 17 and click find. So this is a list of all the active individuals in program 17. And I can then find the client or clients that I want to transfer. So I'm going to select this individual, and let's see, it's an OP, so we will say they're going to program 28. Here is the element of care. I would leave element of care and reintegration setting blank because that only applies to Part 822 programs. If I have the locator assessment ID and the date of the locator assessment, I would enter that information. It is not required in the CDS to enter that information, but if I had it, I could put it in with the date. And then I need to enter the date that the individual is going to the new program. So I will pick that date. And I would need to enter the medication that the individual will be receiving at the new program. So I'm going to say other AED. And then I would come to the bottom and click Save. This will give you a pop-up message that applies to residential programs regarding children in residence. So if you're a residence that has children's beds, this is a message that you will need to move those children before you can transfer the individual to a new program. So you click OK for that. And I have an error message. And the error messages will come up at the top. And this is because I'm trying to transfer someone who has a treatment update that is due. You have to be up to date on all your PAS 26 transactions in order to submit a transfer. So I would need to go back and submit that that treatment update before I could enter the transfer for this individual. So I'll go back. I'm going to click yes, I don't want to leave this page. I'm still going to just click on 17. So now I will try to do other transfers since I can't do that individual. Here I have someone, and I will pick 28. I'm going to leave the locator information blank at this time, and I'm going to say that I don't have it. And I'll put in the date of the transfer and choose the MAT. Because this screen is meant to do multiple transfers, I can enter more than one person. And I believe it has up to 25 per screen. So again, I can pick another program. I'll pick 29. And again, enter the date. If I had the locator information, I would be putting that. And choose Matt. And I could do as many as I needed or wanted to. Go down at the bottom. And click Save. Get the pop-up. And I see the message that they have been moved successfully. So as long as you see this message up here in the corner, you know that it's been gone through and the individual has moved to the new program number. I'm going to close this window. Heidi mentioned that there is another way to submit transfers, and that would be through client management. So I click on client management. This is also the way to submit a transfer if you have a child in residence. And again, it gives you the same search options. as we saw in the previous screens. And I'm going to just search by, let's see, I'll go back and do program. Click find, and again, I get an active list of individuals in program 17. And I choose the individual, and then from the drop down, I choose transfer, MAT update, and I click go. And this gives me one individual at a time, unlike the other screens that gave me 25. And here we see that we pre-populate with the tracking ID, the current program, the last in date or MAT update date. History is a button that is only used for Part 820 programs, and that will show you the different elements of care that the individual has been in. And because it's a transfer, I'm going to click this, and it gives me a drop down of all the active programs for my provider. And again, I will select the program that the individual is going to. Because this is an outpatient program, I'm leaving element of care and reintegration setting blank. I will put in the transfer date. If I have the locator information, I will add that here and the date. And I will enter the MAT information that the individual will be receiving at program 126. And I just shuttle it across. The MAT information on our transfer screens and on all our screens, you can choose more than one unless you choose no mood or AUD. But you would just shuttle them back and forth as appropriate. Click Save. And again, I see the message that it was successful. If I saw the red X with a message, I would need to clear up that error before I could save the transaction. I can then go back, and if I wanted to transfer someone else, I could then repeat the process. So I'm going to stop there, and I'm going to go back to see if we have any questions. So we'll start with, can you confirm this begins 10/1? So the transfer within the same agency and outside the agency. The PAS 47 is required to transfer within the same agency. You cannot use the PAS 47 to transfer outside to a different agency. If the individual is leaving your provider and going to a different provider, a program that is not within your provider, you need to enter the PAS 45 to discharge them, and then the receiving program enters the PAS 47. How soon after MAT changes does the 47 need to be submitted? All of our transactions in the CDS should be submitted within 30 days of the actual clinical event. The one caveat to that is the discharge for outpatient programs, which we give up to 60 days in case the individual had been lost to contact and you were attempting to re-engage. When transferring from an 820, so an 820 intensive residential. So there is not an 820 intensive residential, and there's not an 820 community residence. So the 820 elements of care are stabilization, rehabilitation, and reintegration. Community residence usually maps over to reintegration. I'm going to guess that intensive residential is going to map to rehabilitation, so I'm going to look at this question through that lens. And they are also need to be admitted to an 822 outpatient. Do I use the PAS 44 for the outpatient and transfer from the IR to the community residence? So for the admission to the 822 outpatient clinic, yes, you do submit the PAS 44. For the change in elements of care, as I said, I'm going to interpret intensive residential to be the rehabilitation element of care. It depends. If the program has 3 different elements of care, or they have the 2 elements of care where the client is moving between, That is not a transfer if they're staying in the same program. If they're staying in the same program, but changing elements of care, you would be submitting the transition form, which is the PAS 125. If the 820 reintegration element of care is a different program number than the 820 rehabilitative element of care, then yes, you could do the PAS 47. Okay, so we are going to stop on the questions. Heidi's going to, Emily is going to take over for the MAT presentation, and then we'll go back to the MAT demonstration, and then we'll go back for whatever questions we can fit in the final time.
Complete a medication for addiction treatment update transaction. This transaction is available via the client management/MAT update link. The user can search by program, transaction states, and/or client identifying information. This transaction is limited to entering data for an individual client, not multiple clients. The MAT update transaction can also be submitted via batch. Batch documentation is also available on the bottom of the OASAS applications page on the Home tab. To complete a MAT update transaction, the information needed includes identifying the client, program number, date of the change in MAT that will now be provided by this program, element of care and reintegration setting must be left blank for all MAT update transactions. Locator, assessment ID, and date are optional items. And then I will pass that back over to Teresa.
Sure. Okay. So I'm going to, again, okay. So I thought there was a delay in the implementation. There's not a delay in the implementation. It is starting 10/1, I believe, and Fiki can weigh in with a comment. I believe there's a delay in enforcement till January 1. So it is implemented 10/1. It won't be enforced until, I believe, January 1, 26. So I'm going to go back here. Choose my provider, come to client management.
And Teresa and everyone, just to kind of like bring this point home, this is not for medication dose changes. So those don't need to be done through this system. This is if somebody switches a medication for opioid use disorder or switches from no medication to a medication, etc., any combination thereof. This is for changes in the patient's medication, not the dose adjustments that they frequently need. Thank you.
Correct. So we go back. Here we're back on the screen, and we see that we'll try this again. So I would click the same program. I will need to pick a date after 9/1. Select my MAT, and let's see. Let's try this MAT. And click Save. And we were able to save successfully. So yes, it is the same program, and I shuttled over. I can go back and search for other clients or choose another individual from that list. So let's go back to questions. Let's see, if a client was not getting medication, but that changed, is that when we use the 47M? So yes, if the client was not receiving any MET at your program, and again, this is the program that is dispensing or prescribing the MET, so it is not for, we've had questions come in, if the individual is going to an OTP and they receive a take-home dose and they are residing in a Part 820 program, the Part 820 would not be documenting the methadone MAT. It would be the OTP that is documenting the methadone through the 47. Let's see. Do we need to update current patients that are getting MAT if not on the original admission PAS form? We are encouraging people to enter that information if they're able to. We do understand that it is a lift and a burden, so if you're able to do that, that would be great. If you have not documented that MAT on a previous either admission form, transfer, or the treatment annual update are other places that this information is documented on. Is there an advantage to adding the locator number and date? Why would we, if it's optional? Is it used for something else? So it helps in our data and our data analysis. That is the reason that it's there, but we do not want CDS data held up because you don't have access to that information. I know sometimes other clinicians have entered the locator. You may not have access to it, so please enter your CDS data if you're able to. Is it just change in MAT or dosage of MAT? Again, as Leslie told us, it is just a change in MAT, not dosage, not take-home supply, not frequency. The PAS 47 would be used when a client moves from one medication to another under the same program. That's accurate, correct. We're an outpatient program. When do we use the 47M? The PAS 47 is submitted when there's a change in MAT. So let me go back here. So if there's a change to an add or dropping of the MAT that's shown on the form is when you would submit the 47. What programs are subject to the PAS 47M? That would be all outpatient and residential treatment programs. For MAT updates in a batch, is it going to be the same record type? Yes, it is. It is the same record type used for transfer. We've just altered some of the business rules associated with that 47M transaction in the batch. So you can see the change in the batch specs if you would like to. If so, how will we differentiate? Again, you would differentiate the MAT from the transfer based on the program number that you're putting in as the to program, the same as it's differentiated on our screens. Is this for all current clients? This is for all current clients, not just new incoming clients. Am I correct in assuming that we should start by entering the PAS 47 for all current clients and then update medication changes? What should we do if the client discontinues their medication entirely? So if the individual discontinues their MAT, you would submit it with the no mood or AUD medication within program option. We are encouraging individuals or programs to submit the data for current clients if it was not already documented on a PAS transaction that you previously submitted. But again, that's encouraging, and we know that individuals may not be able to do that. Programs may not be able to do that. Does this go for new admissions? Yes, this applies for new admissions. Now, in an admission form, you will have this question, so you can document the MAT at time of admission, and then if it changes, you would then submit the PAS 47M. Is it only for opioid MAT, or does it apply to all MAT? It applies to all MAT that is documented on that form, so it is for MOUD and AUD. For, you say when you have transferring from a PAS 1 from an 820 reintegration to an 819, but we are no mood or AAD within. So for the 47 transfer form, you would submit change programs. The 47M MAT is specific for a change in MAT. And if you have a specific question about that reintegration, the 819, please feel free to send it to our data management mailbox. So I put the contact information up on the screen for anyone whose question does not get answered here. Please feel free to contact us. And I think Vicky indicated we will be doing an FAQ. Is MAT all MAT or just the major? So MAT is the MAT that's documented on that form. So you can look at the PAS 47M and see if it fits in one of those options. If we are continuing a MAT prescription in our 818, is a PAS 47M required? So 818, I'm thinking is inpatient rehab, and if so, then no. Once the change occurs to MAT, how soon does the 47M need to be submitted? Within 30 days of the clinical event, you are expected to submit the 47M. Do we have to complete the 47M if the MAT is discontinued for a patient? Yes. If the individual stops a MAT, you would submit the 47M to document that. Our clients are in 820. They receive their MAT and psych services through the 820 due to staying in the same provider. They do not receive MAT through 822. So yes, if your 820 has the elements of care of stabilization or rehabilitation, you may be prescribing MAT, and if so, this would apply to your program and you would be submitting the PAS 47M. A question about when the recording is available. It will be available in about 2 weeks. Does this have to be completed with new admissions to a MAT program? The new admission MAT will be documented on the 44. You would only submit this if they change a MAT after or discontinue the MAT after their admission. Is a 47M required for off-label use of Topamax for methadone cravings? I'm going to say that it's not.
Right.
But Leslie can tell me if I'm wrong.
Yeah, you know, I mean, unless there is a build-in of an other, I think what's listed are the recognized FDA-approved medications for either alcohol use disorder or opioid use disorder, and it would not include the off-label use of medications to treat what's not recognized by, you know, it doesn't mean that it doesn't have efficacy, but what's recognized by the FDA is what's recognized in this list, and that's what you would indicate on the PAS 47M.
So, and it looks like Deborah clarified she was meant to be methamphetamine, and these questions asked specifically about OUD and AUD. So no, we would not be looking for that methamphetamine usage of Topamax. We have just reached 11 o'clock, so I will say that we will we'll do the FAQ with the remaining questions, and the contact information is up on the screen. Please feel free to email us directly. Data management for your data entry questions, pick them for your clinical guidance, and we have the ITS help desk for any login issues that you may be having. So I appreciate everyone's time and patience. We will be, I again encourage you to send in your questions. We will answer them, and we will be looking to post an FAQ with the unanswered questions. So thank you everyone for your time. I appreciate it, and with your patience.
Thanks everybody. Great questions. Thank you, Team OASAS. Take care.